Thanks very much, Chairperson, and very much welcome to our guests. I want to join with others who commend the work that the men and women at from every grade group and category in the HSE and the broader health service are doing at the moment and have been continuing to do for the last number of months. My questions are, as ever, fairly simple. Mr. Reid, could you outline for me what the line of communication or how the HSE and the contact tracing personnel communicate with the border management unit in relation to people who travel here, come through our airports and seaports and are supposed to be followed up, although I think all the available evidence suggests that that is scant and rarely happening. But do you have any communication between the border management unit and yourselves with regard to contact tracing or follow-up or additional tests that might be required?
Just very briefly, I might ask my colleague Louise O'Reilly. Just firstly, thanks for your comments again, Deputy. Secondly, on the tracing and border management, we're clear in terms of the HSE's role, which is the contact tracing and following through. The role in terms of where people are and where they're staying, and are they staying where they declared, is a role for a separate agency and body, and that's carried out through a separate process. I might ask Ms Niamh Byrne just to confirm the dialogue.
Just very briefly, because time is tight, Paul. Thanks.
Yes, Deputy, we do communicate. We look for manifests from the flights, which give us details of people on the flights and the contact details when we're doing a trace of a particular flight.
Okay, but beyond that, there wouldn't be any dialogue between you? They don't keep you informed of numbers or let you know how many people have been followed up, if any?
They don't come directly to the HSE with that information.
Okay, and the HSE wouldn't think of asking for that information. Is it not important?
Well, what's important is that once we know there's a confirmed case on a flight, that we do detailed contact tracing of that flight and of that individual and refer those individuals for testing. That's what we do within the contact tracing centre.
Okay, with regard to contact tracing, how many people are full-time employed on it? So not just a number, but if you could express it as a WTE, a whole-time equivalent, please. Just today's figure, how many people are working on it today?
Today there are 100 people who are working full-time for today.
Okay, thank you. How many people are currently in City West? I know it's split into two, so between the field hospital and the isolation facility, what's the number?
We have about 100 in terms of self-isolation, and we had about 60 healthcare workers.
So there's 60 healthcare workers in the field hospital?
Oh no, the field hospitals, they're all part of the self-isolation facility. So in the self-isolation facility we provide two different types of accommodation. One would be for people in general who need to self-isolate and who are referred there through public health, their GP or acute hospitals. The second cohort would be healthcare workers who are in need of self-isolation, either returning to Ireland to work. The actual care facility doesn't have residents as such. We use that now for initiatives. So for example, we have the drive-through glaucoma testing. We are working with CHI in relation to a number of other initiatives in terms of accessing, for example, allergy testing for children, etc.
Okay, so there's 130 people on trolleys today. Could none of them be accommodated in City West, no?
Not in its current format, no.
Okay, I think that's a bit regrettable, but anyway. So the last time we had representatives from workers in the meat processing industry in here, they told us there was a delay of up to 4 days, and in the intervening time a person who was tested then went back to work. That person subsequently, or the line that they were working on subsequently became infected. So I note the figures with regard to the median, but we also know that those figures are skewed by the healthcare workers who are obviously have a very tight and very fast turnaround time. But one thing that did strike me when we spoke to representatives of workers in the meat and food processing industry was the lack of information available to people, because we know this is a migrant workforce, the lack of information available to people in their own language. So can you advise if that information is now available, or if it is a case that it has always been available, just somehow magically didn't manage to get to the floor of the factory? Can you advise what languages this information is available in and how it gets into the hands of those workers who need it? Because clearly a person was tested and then went back to work, and that obviously would not be the advice. So I'm trying to ascertain how that happened. Thanks.
Deputy O'Reilly, Dr. May Mannix is a public health specialist, has led out in this nationally, and as part of our plan, our response to this, to provide information and advice in multiple languages to workers within meat plants. We can go back to you with a specific figure and the languages covered.
Back to you with a specific figure.
And also the number of leaflets that have been distributed. It's they're no use if they're sitting in boxes over in Dr. Stephen's Hospital. Like, they have to be making their way into the hands of the people that need them. So if you could provide us with the information, how many, and the distribution channel, so we can confirm that they're getting to where they're supposed to be.
Yeah, Deputy, we agreed yesterday with the meat plants. They gave us the languages, and we agreed with starting with Polish and Lithuanian, and we would continue with a series of other languages also for the documentation related to the serial testing.
Thanks, Mr.